Hello, I'm Diana Wilkie from the University of Florida, and I'm here today with my colleagues Dr. Ken Redda and Mariana Stern. We're going to share with you a little bit about the administrative core of the CaRE2 Center, which is a bi-coastal center that's focused on promoting cancer health equity. And we do that through translational research, outreach to our communities, and education of underrepresented minority post-baccalaureate students, graduate students, postdoctoral students, and early stage investigators, and by supporting research innovations at our minority serving institution. So first, I'm a professor at the Department of Biobehavioral Nursing Science at the University of Florida, and I would like to allow my colleague, Dr. Ken Redda, to introduce himself.
Hello, my name is Ken Redda, and I'm a professor of medicinal chemistry at Florida A&M University in Tallahassee, Florida.
Hello, I'm Mariana Stern, and I'm a professor in preventive medicine and urology at the Keck School of Medicine of USC, the University of Southern California, and I'm also the Associate Director for Population Science at the Norris Comprehensive Cancer Center.
Thank you. We're very pleased to be here to share with you the information about the CaRE2 Center. The CaRE2 Center is combining cutting-edge expertise and resources for translational research. We're very engaged with cancer research training and education, developing very innovative community initiatives, and really focusing on both process and outcome evaluations as we focus on reducing cancer disparities among Blacks and Latinos. I'm going to turn the presentation over to Dr. Redda, and he is going to share a little bit about our administrative core.
Thank you, Diana. Like Diana explained, we call ourselves the CaRE2 Team. The CaRE2 will stand for the Cancer Research, Education, and Engagement Health Equity Center. This is really a functional, a very effective team, and we are guided by what we call administrative core principles. And at USC, we have Drs. Mariana Stern and Dr. John Captain. At Florida A&M University in Tallahassee, Florida, we have Dr. Renee Reams and myself. And at University of Florida, we do have Drs. Diana Wilkie and Dr. Folakemi Odedina. So this is really a team that really guides the activities of the CaRE2 goals and principles. What are the CaRE2 themes? We want to focus ourselves on the development of Blacks and Latinos across both coasts in Florida and California. We just want to make sure we focus on understanding the subpopulations and capturing the heterogeneity within these populations in terms of cancer research and addressing also health disparities. We also want to make sure that approaches that go from molecule to community are addressed. In other words, you do whatever is valued in research, but also relate to the communities that are around us. We come from the communities, and we make sure we are related to the community that we serve. We also want to include advocates and survivors across these efforts. Inclusion of underrepresented minority trainers across the efforts. We have a very effective training program, including from undergraduate students, graduate students. We have post-bacs, post-baccalaureate students. We have postdoctoral fellows, and we have also early stage investigators. We want to make sure we work hard in terms of training and developing these underrepresented minorities. What are our strategic plans? The long-term goals of the CaRE2 program are, number one, to reduce cancer burden. And we make sure we identify the study health disparities that we observe. And there are so many written about it, and we'll make sure we address that. Particularly, we want to address the challenges faced by Black and Latino populations. in Florida and California, and definitely nationally in the United States. And the other strategic plan we have is to train and increase the pool of underrepresented Black and Latino scientists conducting health disparity research. Number three, to increase research capacity at Florida A&M University. Florida A&M University is a historically Black university, and therefore we have 88% enrollment of Black students and faculty. So we will make sure we will increase the capacity of that institution. And then we want to increase the cancer disparity research at both University of Florida and USC. And then, of course, while we do these activities, we keep in mind that we adhere to all our core values at these three institutions. What are our core values? Partnership. We will make sure we have effective working partnership. We will make sure that our collaboration is very effective. We will make sure that ethical conduct of research are guided by the high levels of scientific integrity. And then accountability to our students, accountability to our faculty, accountability to financial management. At all levels, we want to be accountable for what we do. And then, of course, like I mentioned earlier, our community engagement should be very important for us. This is one of our core values. We value the input we receive from our community. It's a two-way relationship. We want to hear from the community. We want to also share what we know with our community. In all doing this, we want to be very productive. We are funded to carry out these activities. We want to make sure that we are productive with what we're given. And then research and training should be consistent with all the federal, the state, the institutional policies and procedures in terms of doing our activities. We are expected to report to NIH, the National Cancer Institute, and we want to make sure we adhere with all the guidelines that we have. And of course, all of us believe in commitment success. As you can see, the power in Tallahassee is off and on. We have heavy rains and thunders right now. And I hope you bear with me. You may not be able to see my face, but I'm trying to make sure I convey these principles to you.
Thank you, Ken, for that wonderful introduction to our center. So I'm going to share with you what are the specific aims of the administrative core. So as Dr. Redda shared with you, a key role that we play is to oversee all the activities across the partnership. So we do that with 4 specific aims. The first aim is to provide scientific and administrative leadership. And I'll share more details about some of the activities that we do for that. Our second aim is to provide centralized governance and oversight for all the center activities across the partnership. Our third aim is to provide integrated coordination for the cores and the research activities that happen through our research projects. And finally, a very important function that we also play is that we monitor periodically how we're doing, and we document our progress, how we're doing towards achieving our benchmarks, and we use that information to perform continuous quality improvement. And we'll give you examples of all the activities that we do for each of these aims. So the primary responsibilities that we have as the administrative core is first and foremost to ensure that we define and that we uphold the center's mission and our objectives. And to accomplish that, we do a variety of things. Among them, we do environmental scanning so that we can figure out when we need to tweak things and change things and develop new strategies. We direct and manage the implementation of strategies. We ensure that there are adjustments made to our activities to achieve continuous quality improvement based on our own program evaluation and our external program evaluation. We promote and support our existing research projects, and we're getting ready to select new research projects in the coming year. We make sure that all our research projects include minority, underrepresented minority trainees. In our case, we focus on Black and Latinos. That's a very important mission of our center. So we make sure that all our projects include them. And whenever possible, we seek collaborations with other health disparity centers across the country, including other patchy centers like ourselves. So to achieve all these responsibilities, we have come up with strategies to work effectively. So one of the ways that we do that is across the 6 of us, multiple principal investigators and directors of the center, we have self-assigned each of us to one of our cores and projects so that we can have a close relationship with our cores and projects and report back to the administrative core. So it's a bi-directional relationship where we bring information from the administrative core to the cores and projects on a monthly basis, and we bring back to the administrative core what updates about the cores and projects and how they're doing. So for example, at FAMU, we have Dr. Reams overseeing the pilot project and Dr. Redda overseeing the research and education core. We have Dr. Odedina at UF overseeing the planning and evaluation core, and Dr. Wilkie overseeing the project 1 and the bioinformatics and statistics methodological core. At USC, Dr. Carpenter oversees the tissue modeling core, and myself, I oversee the community outreach core and our project 2. Another way that we achieve the oversight of our center is that we worked hard in developing governance documents that help guide the work that we do. So we have our statement of work, our timeline, we worked on our strategic plan. We also have a procedures manual that we use that summarizes all the activities we do. We have a tracking system to ensure that all the responsibilities we have are carried out. We use a system of reporting 3 times a year. We have reports from all the cores and projects that are evaluated by our plan evaluation core. And we also have guidelines for membership for our center, and we have developed those and also a database of members. So now I want to tell you a little bit about our aims. I'll tell you about our first 2 aims, and then my colleague, Dr. Wilkie, will tell you about our 2 other aims. So aim 1 is about scientific leadership. How do we accomplish that across the partnership? So we do that in a variety of ways. The liaison example that I share with you is one. We also work hard on having annual investigator meetings. We have been doing them in conjunction with the American Association of Cancer Research Cancer Health Disparity Conference, which happens every year in the fall. We all attend that conference. Many of us have served in the scientific planning committee for that conference, and many of our CaRE2 members present at that conference. So it's a great opportunity to get all together in one place and share some time together. So we usually spend 1 day before the conference meeting and discussing and giving updates on our projects, brainstorming, strategizing. So that's one way that we all come together. As administrative core, we also oversee the feedback that we get from the planning and evaluation core, which happens 2 times a year, and then a 3rd time when we prepare our reports that go to the NCI. We also launch a webinar series that happens every month and showcases our own researchers as well as other cancer disparity researchers across the country. We worked on developing a mentoring plan, a career development plan for our early stage investigators. We also oversee the submission of new grants and supplements to our U54 grant. And we oversee all aspects of sample transfer and data transfer across institutions to accomplish our projects. And this year we are working on overseeing and planning the call for new proposals that will start in our year 4. Where we're going to fund 3 new research projects. So we are working in partnership with our planning and evaluation core to select the new proposals. Another way that we, so those are examples that I share with you about how we accomplish our scientific leadership. In terms of our administrative leadership, some of the things we do are our administrative team puts a newsletter, a quarterly newsletter summarizing all the activities in the center and sharing some of our highlights from our trainees and from members of our center. We also developed a partnership website that we're going to launch very soon in the coming days. It's going to be completely finalized and released. And so we worked on developing our own identity, our social media platforms that we use to showcase our accomplishments and our trainees. We also work hard from an administrative perspective in communicating with the NCI and with our program steering committee so that we can have a bi-directional relationship and make sure that we are in compliance with the regulations from NCI, but also that we hear the advice from our program steering committee and we can implement it. So for our second aim, for this aim, we want to achieve centralized governance and oversight of our center. So some examples of how we accomplish that is that we work closely with our community outreach core after year 1 to revise their specific aims to make sure that they better fit the expectations of NCI and our program steering committee. We work closely with our tissue modeling core to develop a system for sample requests, which is now live on our website, and also with the bioinformatics and statistics methodological core to develop a service request form that is also in our website so that anybody across the center who wants to request their services can submit a request. And we're also working with our projects and cores to oversee the development of our governance documents in similar manner as the documents that we develop for the administrative core. So these are some examples of how we achieve centralized governance and oversight of activities in the center. So I'm going to hand it over to my colleague, Dr. Wilkie, so that she can tell you more about our aims 3 and 4.
Thank you, Dr. Stern. I'm very pleased to be able to share the other parts of our work related to aim 3, where we're really focused on trying to have strong integration and coordination and management of all of the center activities. We have established regular meetings for all of the cores and the projects, and these are attended by all of the members, as well as the members from the administrative core that serve as liaisons to the projects or the cores. Since we are a bi-coastal center, this takes a tremendous amount of coordination because of our extreme distance between our center, the components of our centers, but also the time zone issues. So we have found Zoom is usually the way that we can meet, and we reduce the distance and we reduce the time as long as we're planning well about when we will meet, so that it's not too early in the morning or too late in the afternoon. However, we have been known to stretch the envelope, and we're very grateful that our colleagues in California sometimes start very, very early, and sometimes our colleagues in Florida work very, very late into the evening so that we can be able to transcend that distance and that time zone issue. Part of the reason we're able to do so is because we have wonderful center administrators at each institution, and they work very diligently and very effectively to coordinate all of this work that's being done among the COREs and the projects. And so we have Ann Taguchi at the CaRE2 Center in California, and Christine Lavender has been our coordinator, and we have a new coordinator that's joining us in Tallahassee in Florida at FAMU. Nissa Atkins is also at the Lake Nona campus at the University of Florida. Amelia Greenlee helps us at the University of Florida Gainesville campus, and Parisa Fathi helps us at the Lake Nona campus at the University of Florida, where the Lake Nona campus is our main coordinating site for the University of Florida part of our center. So we have wonderful support, and without them, we would have great difficulty in accomplishing all of our goals. We also, our fourth aim really focuses on our monitoring for continuous quality improvement. This happens because we have a wonderful planning and evaluation core that is very dedicated to helping us with all levels of evaluation, focusing on communication, focusing on all of our benchmarks and all of the activities that the cores and projects indicate will be the focus of their work during the particular timeline of interest. And by doing this evaluation, we plan to have very transformative action plans so that we're always improving the center activities and outcomes. To be able to achieve our lofty goals of reducing these health disparities, it means that we really have to be very focused on our evaluation data so that we don't lose sight of what our core mission is, and that we stay true to our core values. And our evaluation data is very helpful in allowing us to do that. And our program evaluation core has been extremely helpful in helping us to set our plans for this continuous quality improvement. You can also imagine that being bi-coastal and at 3 different institutions, and each institution has its own culture, that there are challenges. And so indeed, our center does face challenges. We don't like to be like an ostrich with our head under the sand. We really like to keep our challenges out front, because it's through solving the challenges that we're going to be able to achieve our goal, which is to reduce cancer health disparities. So we have had some challenges with finding the right balance to allow our CaRE2 scientists, especially those that come from laboratory science, to be able to be comfortable and with communicating with our community education activities. There was originally a little bit of reluctance to do so, but it's been really exciting to see that as some of our scientists have ventured out, they really see the importance, and they found that it was a very, I heard one person say it was really fun to do. And they learned that they needed to have different skills. So I think it really helped to bring some sense of how it takes the entire center and the skills of the community outreach core, that we can all learn from each other, and we can all be better in the work that we do to reduce cancer health disparities. We've also developed a CaRE2 Cancer Link YouTube TV program, and we've developed a citizen scientist program that allows community members to learn more about science and become advocates for research, because they've been in the midst of some of the projects being done in the labs. They've gone to the biorepository and they see what's happening with samples. They're truly engaged in the work that we're doing. And we're hoping that that will help to improve the communication with our communities. We also are very aware that this particular year has been a bit challenging because of the COVID-19 pandemic. And we had to really get our thinking caps on so that we could convert our in-person meetings to a virtual meeting, and to have the many, many people who are involved with that all receiving information on time, and to be able to work through the Zoom. But I think we've discovered, as many other people have discovered, that telemedicine or telecommittee meeting is a very effective way to be able to meet. As our laboratories come back online, that will help, but we do know that some of our work has been delayed for some of our projects. But I think that during that period of time, the investigators have been very thoughtful about the next steps for their projects and thinking about new projects, and certainly writing up the results of experiments that have already been conducted. The other challenge that we have is having the true integration across the partnership. Our partnership is only 2 years old, and so we are still learning to work with each other, but we keep our focus on our metrics and the feedback through our program evaluation committee, or CORE, and that allows us then to be able to facilitate the integration. Our coordinators help with that in terms of communication, and then our webinars are bringing us closer together also. So although these are challenges, with each challenge we rise to the occasion and overcome the challenges so that we can really focus on the work that is so important. We're just about to move into year 3, and our plans for that, as Dr. Stern just mentioned, is to be able to select and fund 3 new projects. That would be 3 teams. Each project we require that each project has a investigator from a principal investigator from each institution. So that is a project that is working in a multi-principal investigator model. And of course, there will always be trainees as part of that team. And we try to have community members be part of those teams also. And certainly members from the community outreach core can be part of those projects. So we're in that midst of that selection now, and are really excited about the new science that is emerging from our initial expression of interest in submitting applications for this the new projects. We also are continuing to stay focused on helping our 3 projects to come to completion and then to transition with new funding. We are focused on transferring technology to FAMU with trying to have an organized technology that will be very useful for the scientists at FAMU. We're also focused on the oversight of our activities to make sure that our benchmarks are achieved, and that we're overseeing the career progression and the success of our CaRE2 early stage investigator trainees. We are very committed to the next generation of scientists, and these individuals are our bright future. So we're really excited to be facilitating and working with them over in year 3. And then finally, an important piece for year 3 for us is to expand our network of collaborators, both within CaRE2, but also within the rest of the PATCHY program. We've been focused in the first 2 years on establishing our partnership, and now it's time for us to reach out. We've done some good things in terms of creating some webinars that we can share with our colleagues, and we're really looking forward to being able to work with the Greater Apache program. And then in conclusion, I would like to share with you how you can reach us. We have many different methods to reach us through our Twitter account, which is set up for our centralized CaRE2. We have websites that are set up, and we're going to be having our official website be available soon. So we don't have that HTTP URL yet, but we will have that soon, and that will be available on any of the rest of these websites, or you can check out our various Twitter accounts. So that sort of sums up the structure, our mission, our structure, the way that we organize our work, and our aims that we're focused on, and the progress that we've been making to be able to advance the scientific and community engagement and training of investigators to reduce cancer health disparities. I'd like to take a couple minutes to ask Dr. Redda if taking the liberty to say, well, Ken, what are your hopes for our partnership?
Well, thank you so much, Diana. You gave a great presentation. Always the most important thing to me at a personal level, at a professional level, is that I see so many Blacks and Latinos and Latinas underrepresented every day in the United States. I have been involved in my institution for 35 years. And I was also serving as an assistant professor at the University of Puerto Rico for some years. So what I see is that these populations are really underrepresented. And we know that underrepresented minority patients really find themselves easy to relate to one of their own. That's natural, it seems. They feel there is a fear factor when somebody wants to see when a patient wants to see a physician. They really want to find somebody they can easily relate to. So addressing this disparity is the most important aspect to me. And therefore, if there is a program, if there is a center that advances the goals of increasing the representation of these URMs, that is my hope. Eventually, we need to make sure in the health profession, we want to make sure representation is fair and equitable. And so my hope is that eventually in about 10 years' time, or even shorter, that this gap is narrowed, and that we really, the health team really reflects the composition of the population that serve the population. So that is my hope. Representing.
That's a wonderful aspirational hope. It's achievable. We're going to make it be achievable. And Dr. Stern, what are your hopes for our partnership?
So my hopes of course, are very much aligned with what Dr. Redda expressed. I think we don't have enough representation of our minority populations, particularly Blacks and Latinos, in cancer research. And there are studies that have looked at this issue, and there's many barriers that have been identified that prevent some of our young investigators who are minorities to get as far in their careers as non-minority investigators do. So I feel a sense of responsibility that we have to help make sure that early stage investigators are successful, are given opportunities to succeed, and that we really increase the workforce of minority scientists, because many studies have shown that when you have minority scientists working in cancer disparity questions that involve those minorities, progress is made faster because there's a sense of responsibility, engagement. People identify with the issues, they have many experience those issues, so they can apply some of that personal knowledge into their research questions. So it's very important to include minorities when trying to address cancer health disparities. So I'm very hopeful and excited about the prospect that we can be part of the catalyst of training that next generation of minority underrepresented scientists. And I also have high hopes for the ability of our center to sponsor and to foster more research on cancer health disparities at our institutions. So I'm based at the Norris Comprehensive Cancer Center, which is it's in the middle of one of the largest, most populous cities in the world, right in Los Angeles, which is also probably the more diverse urban area in our country and perhaps in the world, where we have representation from every nation. And we have a large, probably the largest Hispanic population with many issues that they face in terms of their access to care and disparities. And so this center is giving us the opportunity to develop more research to meet the needs of this population that is our majority population in Los Angeles. And our cancer center has been done pretty well in terms of fostering research in cancer health disparities, but there's still room to grow, and there are opportunities that haven't been tapped. And so one of my hopes is that through these partnerships with University of Florida and with FAMU, we can foster new teams and new research addressing disparities in our Black and Latino communities. Since the CaRE2 Center started, we have been reaching out to more of our Black communities in South Central LA. We have been expanding our research in Blacks and Latinos. So I can already see some of the impact that we are having at the Cancer Center. And I'm hopeful that as the years move forward, our impact is going to be even greater, so that we can not only address the disparity of representation of minority scientists, but also address the huge disparity of research representation. We don't have enough research that is being done among Blacks and Latinos. Particularly for Latinos, the amount of research that is being done is very dismal. There's a lot of things we don't know, and we don't have enough people working on those questions. So I'm really hopeful that our center can contribute to both, mentoring the next generation of underrepresented minority scientists, but also fostering more research on cancer health disparities among Black and Latinos.
Well said. It's very, very exciting what we have the potential. And I will sum up that my hope is that we have underestimated our potential because we set our goal to reduce. I think we should eliminate the cancer health disparities. That we understand the heterogeneity within the Black and Latino population they are not homogeneous populations, and that through these insights that our whole world will become much more focused on equity at all levels of our social and governmental structures. So we're putting in a little drop, and we've like skipped a little rock, and it's going to make a lot of ripples. And I'm really, really excited about what our partnership can do, because we're doing it together, and that's very, very exciting. So thank you very much for joining us today. We invite you to visit us and join us at any point in time. You have a good day.